The rise of plant-based diets has sparked a wave of enthusiasm in the fields of preventive medicine and oncology. Veganism, in particular, is often viewed as a natural, detoxifying, and even anti-cancer dietary strategy, rich in fiber, antioxidants, and anti-inflammatory compounds. For many, the appeal is both ethical and health-driven. Cut out animal products, reduce disease risk, and live in better alignment with planetary well-being. But when it comes to cancer prevention and survivorship, the story is not as straightforward as the wellness world would have us believe. A vegan diet can offer clear benefits, but it can also carry significant risks if not carefully managed, especially in patients who are already vulnerable. There's strong evidence that diets high in fruits, vegetables, whole grains, legumes, and nuts are associated with a lower risk of several cancers, especially colorectal, breast, and prostate. These foods contain phytonutrients, fiber, and antioxidants that support immune function, reduce inflammation, and promote a healthy gut microbiome, all critical factors in both cancer prevention and recovery. Plant-based diets also tend to reduce intake of processed meats and saturated fats, which are linked to increased cancer risk. In that sense, the plant-forward approach is well supported by the data. But veganism, strict exclusion of all animal products, raises a more complicated nutritional equation. When done without professional guidance, it can result in serious deficiencies that undermine the very health outcomes patients are trying to improve. Vitamin B12 is a glaring example. Found almost exclusively in animal-derived foods, B12 is essential for red blood cell production, neurological function, and DNA synthesis. Deficiency can lead to anemia, nerve damage, and cognitive decline, all of which can be devastating for cancer patients, especially older adults or those already experiencing treatment-related fatigue or neuropathy. Many vegans do not supplement adequately or check levels regularly, making silent B12 deficiency a real threat. Iron is another critical nutrient often overlooked in vegan oncology diets. While plant-based sources like lentils and spinach contain non-heme iron, it is less bioavailable than the heme iron found in meat. This means vegans may absorb less, even when they eat plenty of iron-rich foods. The result can be chronic low-grade anemia, which in cancer survivors can worsen fatigue, reduce exercise capacity, and impair recovery. Iron supplementation is sometimes necessary but also tricky, as too much can be inflammatory or even promote oxidative stress, which may negatively impact certain cancer outcomes. Omega-3 fatty acids, particularly EPA and DHA, are also commonly lacking in vegan diets. These long-chain fats, found mainly in fatty fish, play a critical role in regulating inflammation, supporting brain function, and possibly suppressing tumor growth. While some plant sources like flaxseed and walnuts provide ALA, a precursor to EPA and DHA, the body's conversion efficiency is low, especially in individuals with inflammation, which is common in cancer. Vegan omega-3 supplements derived from algae can help, but are often underused, especially among patients self-navigating their diets without dietitian support. Protein sufficiency can also be a concern. While many vegans meet protein targets, those in cancer care often face increased needs due to surgery, chemotherapy, or muscle-wasting conditions like cachexia. Relying on plant-based sources alone requires careful planning to ensure adequate intake of all essential amino acids. Without this, loss of muscle mass, weakness, and slower wound healing can occur, problems that compromise both quality of life and treatment success. This is where personalized nutrition becomes critical. A vegan diet can be compatible with cancer prevention and survivorship, but only when it's nutrient-aware, regularly monitored, and adapted to the individual's medical and metabolic needs. What works for a young, healthy vegan influencer may not work for a 65-year-old breast cancer survivor recovering from chemotherapy. Cancer patients are not generic bodies. They are metabolically altered, immunologically stressed, and often dealing with side effects that interfere with digestion, appetite, and nutrient absorption. Blanket dietary prescriptions are rarely appropriate. There is also the psychological component. Some cancer survivors adopt veganism with the belief that it will prevent recurrence, a belief often reinforced by online communities, documentaries, or unproven anti-cancer protocols. While motivation to change diet is commendable, it can also create stress, guilt, or rigidity, especially when patients struggle to meet nutritional goals or when the expected health payoff doesn't materialize. Some may refuse clinically indicated treatments in favor of extreme diet changes, which can lead to tragic outcomes. Ultimately, vegan diets in oncology are neither miracle cures nor inherently dangerous. They sit in a gray zone, capable of supporting health when well-designed, but equally capable of causing harm when adopted haphazardly. The key is balance, not ideology. Evidence supports plant-forward eating as a cancer protective strategy, but for patients in treatment or recovery, dietary choices must be grounded in nutritional adequacy, not belief systems. Professional guidance matters. Blood work matters. Supplementation, when necessary, matters. And flexibility, not rigid purity, is often what sustains long-term health. Veganism can be part of a cancer survivor's path, but it should never be followed blindly. In the complex terrain of oncology, nutrition must be both compassionate and clinical, hopeful yet realistic. Anything less risks turning a tool of healing into a source of hidden harm.